UNICEF is warning that progress in HIV prevention and treatment for children, adolescents and pregnant women has remained stagnant for the last 3 years. Many regions around the world are still not back to the pre-COVID-19 service coverage. This comes on top of an existing and growing gap in treatment between children and adults. Well, for more on what they have found, let's speak to UNICEF's Regional HIV Advisor for Eastern and Southern Africa, Laurie Gulaid. She's joining us now live from Nairobi via Zoom. Laurie, good afternoon. Welcome to today. So how bad is the situation, or how concerning is it, the fact that there's been this stagnation in terms of prevention, HIV prevention and treatment for children, adolescents and pregnant women?
Thanks, Dan. Thanks for having me and giving some time to this important topic today. As you know, as UNICEF, one of our key roles is to monitor children's rights, and this is really about the basic right to health. And we've just released a new report, the Snapshot Report, that really powerfully focuses on the inequities faced by children and adolescents. There's a significant treatment gap between children and adults, and it is indeed serious and calls for urgent action.
So what have you seen? I mean, how, in terms of the numbers, I mean, how concerning are the numbers?
So there are 2/3 of the world's children and adolescents living with HIV are here in this region. That's about 2.7 million children. And South Africa itself is home to 450,000 of those children. And what we see across the region is that 4 out of 5 adults with HIV are accessing treatment. That's a remarkable accomplishment and something everyone should be proud of. However, only just over half of children are accessing treatment.
Yeah.
And in addition to that,
yes,
go ahead.
No, you go ahead. You go ahead.
In addition to that, we have another group we're quite worried about, and that is adolescent girls and young women. A powerful force in the region, but really shouldering a heavy, disproportionate burden of the new infections in this region and in South Africa.
What is driving that?
So for the adolescent girls and young women, it's about things we're all very familiar with: poverty, gender inequity, lack of access to basic rights, including sexual and reproductive health services, education, and others. The good news is that when we work together to address those issues, we will do a lot more than prevent new HIV infections.
Yeah. What did you find? South Africa, I mean, this country has been always at the epicenter of the epidemic. Just the other day, I spoke to one of our scientists who's very much involved in the fight against HIV/AIDS, and they were concerned that in South Africa, we're seeing, for example, men aged 25 and about, and a little bit above that, are not testing, for example, for HIV at this stage.
You raise a really good point. Let me just first say that South Africa continues to have the largest national HIV epidemic in the world, followed by Mozambique and Nigeria. Huge progress has been made in South Africa, and so we should never underestimate that. For example, the percentage of pregnant women living with HIV that are on treatment has been sustained above 90% for quite some time. And that means there are over 460,000 children in South Africa that did not become HIV infected at birth or at breastfeeding. However, you're right. Each population group is different, and men do not test and treat as frequently as women do.
Yeah. So what needs to be done, in your view, as UNICEF, to end AIDS? What kind of solutions are you thinking, particularly as well around this whole issue of HIV prevention and treatment for children, adolescents, and pregnant women? What's the way forward, Laurie?
Thanks for the question about the way forward. Most important, we need some extra investment to really focus on the unique needs of children and adolescents. Early childhood and adolescence are times of rapid development and change, and there isn't a one-size-fits-all. What we do for adults is not going to work as well for children and adolescents. We need mental health support. We need extra support for caregivers. We at UNICEF have worked with governments on many examples of providing peer support, which seems to be extremely helpful. We need to scale up some really innovative testing methods, such as point-of-care testing, which gets the result to the mom faster, self-testing for adolescents, and others. And most importantly, we need to layer. We don't need to work on HIV alone. We must consider education and other things that affect adolescent girls and young women and children as well.
Yeah. Finally, Laurie, is there any other question, or what would the message you'd like to land as UNICEF as we conclude our discussion beyond what you've just expressed in terms of the way forward? Is there something that we're missing in the fight against HIV?
I think we're doing a great job. I would just really plead that we consider our youngest citizens and think about how to provide services at the facility and community level in a primary healthcare framework that really meet the needs of these important populations for our future.
Thank you very much. That's UNICEF's Regional HIV Advisor for Eastern and Southern Africa, Laurie Gulaid, and she was talking to us from Nairobi after they had issued their report as UNICEF focusing on children and adolescents and pregnant women in terms of World AIDS Day, which was yesterday. A lot of work still has to be done, while there is still progress, of course, that has been made. Now,